days after a short video visit about a swollen ankle, Maria ended up in the ER with a fracture that needed surgery. I still think we could have caught that earlier.
Hi, I'm Jess, a family nurse practitioner and legal nurse consultant. If you want telehealth visits that actually save time and keep you safe, this episode is for you. Let's get into a simple playbook.
I thought a video and some rest would be enough. 2 days later, I couldn't put weight on it.
That story shows exactly where small prep steps matter. Over the next 20 minutes, I'll give you a clinician-tested checklist, what to gather before the visit, quick tech and privacy checks, how to describe symptoms so clinicians can act, what telehealth can and can't do, and what to expect afterward. First, the single most useful habit, 1 page. Not 5 pages, not an essay, 1 clear summary you can hand over in 15 seconds. On that page, put your name and date of birth, emergency contact, a short meds list with doses and how you take them, any allergies and the reaction, and a 2-line medical history. Add a 1-line symptom timeline, when it started and how it's changed. Practical tip. Snap a photo of your medication bottles or pill box and keep it with the summary. If you take OTC meds or supplements, list those too. They matter. Keep a thermometer reading and the time you took it if fever's an issue. Photos and video are golden for skin, wounds, swelling, or movement problems. Take well-lit photos from a couple of angles. Include a ruler or a coin for scale if you can, and record a short video of function. For example, walking 5 steps or standing on tiptoe. Upload these to the portal or have them ready on your phone. 5-minute tech and privacy check before the call. Charge your device, prop it on a stable surface, and test camera and mic. Move to a quiet, well-lit spot and use headphones if you want privacy. Close other apps and mute notifications. Interruptions waste the clock. If your Wi-Fi is spotty, move closer to the router or switch to cellular if that's better. Have a backup plan, a phone number for the clinic saved in your contacts so the visit can continue by audio if video fails.
Consent and privacy. Your clinician should tell you who is on the call. If you don't want others present, say so. You control who's in the room. If the clinic records visits for quality, they should ask your permission first. Don't use public Wi-Fi for sensitive conversations when you can avoid it. Trust your gut if anything feels off.
Let's talk about how to describe symptoms so a clinician can actually act. Start with timing. When did it begin? Then severity and function. How bad is it, and what can you still do? Finish with what makes it better or worse. A short sample. My cough started 3 days ago. It's worse at night. I had 1 fever of 101 degrees Fahrenheit yesterday, and I get short of breath when I walk to the mailbox. That gives a timeline, severity, and a functional clue.
For pain, say where it is, rate it 0 to 10, and describe the quality. Sharp, dull, burning, and give an example. I can't climb 1 flight of stairs without stopping. That kind of concrete detail makes remote decisions safer.
Don't leave without an explicit action plan. Ask, what would make you want me to come in today? Which symptoms mean urgent care or the ER? And when should I expect a follow-up? These questions get you a decision, not just reassurance. What telehealth can do well: triage, medication checks, mental health follow-ups, chronic care check-ins, and many uncomplicated infections. It's fast and often very effective for these problems. What it can't replace: hands-on exams. You can't reliably listen to lungs, palpate an abdomen, or fully assess some wounds or fractures over video. Treat telehealth as a powerful first step, not the final answer, when hands-on care might change management. Red flags that need immediate in-person evaluation include new or worsening trouble breathing, chest pain or pressure, sudden weakness or slurred speech, high fevers that don't come down, uncontrolled bleeding, or sudden confusion. If any of those are present, say so now and seek emergency care. Telehealth is not a safe substitute for emergency assessment in those cases. After the visit, ask how prescriptions will be delivered and when referrals or labs should appear. Request a visit summary or message with next steps, and save the clinician's name and visit time in case you need to follow up. If you feel worse after the call, escalate. Call the clinic, ask for triage, go to urgent care, or head to the ER depending on severity. Keep a short log, time symptoms changed, what you tried, and who you called. That log can be invaluable if care needs to be escalated. Quick troubleshooting lines if tech fails mid-visit. I can't see you. Can we switch to audio? Or, my video froze. Can you call me at this number? Offer to text photos or use the portal if video quality is poor. Clinics expect hiccups. A backup phone number in your chart is smart. Before I wrap up, here are 3 things to do before your next telehealth visit. 1. Build that one-page summary and keep a current meds photo handy. 2. Run the 5-minute tech and privacy check. Charge device, headphones, good light, vitals nearby. And 3. Know your red flags and ask the clinician, if I get worse, when and how should I come in? Having that one page and the photos would have changed the whole visit for me. If you want the one-page checklist, it's in the episode notes as a downloadable PDF you can print or fill on your phone. Upload your meds photo to your patient portal if the clinic supports it. That small step often changes a recommendation from watch and wait to come in for an x-ray. If this episode helped you feel more prepared, please subscribe so the next practical checklist lands in your feed. No fluff, just what works. Share this with someone who uses telehealth. It could make their next visit safer. Thanks for listening. If today's episode helped clarify a medical or legal issue, or made you think differently about how emergencies and accountability intersect, that's exactly why this podcast exists. You can learn more or schedule a consultation at FAQbyNurseJessicaConsulting.com. Until next time, stay informed, stay compassionate, and always put safety first.